In this video, we are going to see how to stop breastfeeding. The process of stopping breastfeeding is called weaning, and it can be done gradually over several weeks or months to help ease the physical and emotional transition for both the mother and the baby. Here are some techniques that can be used to stop breastfeeding. First, we will see gradual weaning. This involves gradually reducing the number of breastfeeding sessions and replacing them with bottle feeding or solid foods until the baby is fully weaned. Focusing on slowly reducing the number of breastfeeding sessions over several weeks or months. For example, a mother may start by eliminating one breastfeeding session per day and replacing it with a bottle or solid food. Over time, she can gradually eliminate more breastfeeding sessions until the baby is fully weaned. The gradual approach can help to reduce the risk of engorgement, mastitis, and emotional distress for both the mother and the baby. Number 2. Distraction techniques. Offering the baby a favorite toy, book, or other activity that can help to distract them from the desire to breastfeed. This can be especially helpful during times when the baby is most likely to want to breastfeed, such as before nap time or bedtime. Number 3. Shortening breastfeeding sessions. Gradually reducing the length of each breastfeeding session can help to reduce milk production and decrease the baby's reliance on breast milk. For example, a mother may start by shortening each breastfeeding session by a few minutes each day until the baby is only nursing for a few minutes per session. Then, offering alternatives. Offering the baby a cup or bottle of expressed breast milk or formula can help to reduce the baby's dependence on breastfeeding. This can be especially helpful if the baby is resistant to weaning or if the mother is experiencing discomfort during the weaning process. The last technique or advice is engaging in self-care. Engaging in self-care activities such as exercise, meditation, or relaxation technique can help to reduce stress and improve emotional well-being during the weaning process. This can be especially important for mothers who may experience feeling of sadness or anxiety during the weaning process. One more thing, applying tamarind or neem juice on the nipple is a traditional method of weaning in some parts of India. However, this technique can cause pain, irritation, and inflammation in the nipple or areola, leading to the breastfeeding problems such as mastitis or blocked milk ducts. It's important to note that weaning should be done gradually and at a pace that is comfortable for both the mother and the baby. It's also important to talk to your doctor or any professional for guidance on the best weaning technique for your specific situation. So thanks for watching the video. If you like the video, please click the like button and subscription button. Thank you.